Hello, it's Shelly with Shelly's Nursing Review. I thought I would take some time to explain why it is you might want to consider our program for your Nclex review. As a new graduate LPN or RN, or a nurse who has failed this test maybe several times, or maybe even an international student who has come here to America to be a nurse and your training is a little different than ours. Number one, you are an individual. As an individual, you will come in and you will take something called a pre-assessment exam. This pre-assessment exam is going to give me some idea as to where you fit along the spectrum of students, because some students qualify for boot camp, which means they spend about 3, 4, maybe 6 weeks in my course. Other students have a very high risk background and they may spend up to 6 months in my course training all over again, really to be the best nurse in the world. Now, that being said, whether you spend 3 weeks or you spend 6 months in my course, it's the same price. That's pretty cool. There are students who have a background of maybe going to a bad nursing school, and I say that based on the fact that their Nclex passage rate is horrible. Or maybe this is a student who has gotten their education from a brand new nursing program that ultimately may be the greatest nursing program on earth, but right now they're very new and there may have been some chaos and changes in curriculum and changes in instructors and just a little bit lacking what you need to pass the Nclex. So once you take your pre-assessment, you are enrolled into the program. For those students who need a payment plan, we do have a payment plan. We take traditional as well as non-traditional students. What is traditional? I get that question all the time. Traditional students are students within 30 days of graduation. They are brand new graduates. They have never taken the test before. They have signed up for my program while in school or immediately after, which is highly recommended. The non-traditional student can be a student who has waited more than 30 days past graduation to sign up, and we all know that the longer you go out of a program, the more you forget. Or it could be that nurse that has failed the Nclex countless times, even just one time, but just they failed the Nclex and they're feeling like they need a little bit more. The non-traditional student price is higher for a reason, because those students tend to need more of my time and more time in my class. So that's the difference between the traditional and non-traditional student. The other thing is, while you're in my course, you will learn every single subject the way maybe you should have learned it to begin with. So we have lots and lots and lots of handouts. We combine hybrid education with regards to you getting most of your education from me, standing up lecturing, and then some of your education in your pajamas at your house, maybe in your living room with your little one sleeping, and there you are in your home, in the comforts of your home, watching CNR Virtual, which is just our program where you can access our videos right from your home, either on your phone or your laptop. Now, the subjects vary all over the place. There's renal, there's cancer, there is psych, and you always have a video with the actual course itself. So if you're at home and this week we're doing psych, then you would literally have a psych, access to the psych video, and you would have your psych packet to take notes on. As you know, the big focus on our exam that you are trying to pass is management of care, but we have everything. We have HIV, we have acid-base imbalance, we teach you procedures, we have, oh yeah, do not underestimate maternity. We have the very difficult and complex endocrine system. We teach you the diabetes, we have respiratory, we have neuro, we have so many handouts that by the time you are completing, you're finished with my course, your binder is this big. Now, of course, we don't share that information because it took me 53 plus years to get it, and you paid for it, and that's completely unfair to you and me to give it away to someone who did not earn it or pay for it. Now, that being said, once you're in my course, my class, my curriculum, my program is very difficult. I am very strict because I believe that you are a professional, and as a professional, you are expected to be on time. You are expected to attend the class. You don't want to really miss a lot of days because if you miss a lecture, you miss a lot. And so it is a hard course, it is. But then my nurses are not like anyone in the world. They are truly the best in the world. They change this world one patient at a time. Now we have 3 locations. Within the next week, we will be opening our 4th location. We are in Columbus, we are in Elyria at Lorain Community College. The Columbus site is out of Ashland University. We are in Highland Heights in the Alpha Park area right across from Progressive Insurance. And then we are also on the we are opening up in Akron, hopefully within the month. So we are everywhere with our campuses just to accommodate those students who really are trying to get somewhere everywhere they could find us. We also have lots of schedules. We have a Monday and a Wednesday out at the West Campus in Lorain Community College. We have Fridays with virtual study out in Columbus. We have a Tuesday, a Thursday, and a Friday out at Highland Heights. We have a Saturday flex program for those of you who work so much during the week and you really don't even know what day you're going to get off during the week. You have no control at all over what day are you going to get off during the week. And so all you're required to do is the 2 Saturdays a month with a flex day during the week or every Saturday for that student who works 9 to 5. Now, let me just finish by saying I give you my word that you will pass this Nclex exam. I get it. I know that school is hard. I know that you feel like you are ready. I am here to tell you that this test is harder, and it should be. If you are being certified for the rest of your life, which is what Nclex is doing, whether you're an LPN or RN, you are being licensed to practice for the rest of your life and you never have to take another exam. Why shouldn't this be the hardest test you've ever taken in your life? But I got a news flash for you. If God brought you this far, He'll take you all the way. So have a little faith, get yourself together, find you some money, give me a call, and let's make this happen. But I do. I give you 100% money back guarantee. And frankly, I went to school and got a PhD in this career. So I literally put the money behind my name, went to school, got the PhD. I'm doing my research, and when I finish, I will be completely finished with mastering in the Nclex review. I've already finished my coursework, so why not invest? I've invested in your learning. Now come on, invest in yourself. Give me a call, 216-410-0936. If you want a rapid response, text us, because I'm probably teaching, honey. I can't answer the phone in the middle of class. God bless and good luck, nurse.